Welcome. Hundreds of emails are flowing in, all about the neck. People cracking their neck, stretching their neck, and wondering what they're doing to themselves. When they're hearing the videos, they're kind of panicking, getting scared. They're asking questions. Doc, how do I stop cracking my neck? I've been doing this for years. I'm developing these problems neurologically. I continue to have this chronic problem that I used to have that's getting worse, tingling or burning into the arm or hands. The symptoms are getting worse. What do I do? Well, you're going to stop. And I'm going to tell you some ways and different alternative things that you can do to combat this problem. But I need to give you a quick review for our new listeners. We have a normal curve in the neck. Between the neck, we have discs. We have nerves that come out between the levels of the spine. They control the different areas throughout the entire body. The nerves in the neck primarily control the back of the head, the shoulders, down the arm, to the hand, to the chest, between the shoulder blades. Obviously, the nerves control different organs and muscles as you make its way down. But for our sake, people that are just taking their head and pulling it over and just yanking their head, you're stretching ligaments. The ligaments hold bones together. There are muscles in here. If the muscles, in order for the muscles to work correctly, those ligaments got to be tight. If you take a rubber band and you overstretch it, like you're just cracking and stretching, the ligaments become loose, putting more stress on the muscles. The muscles start to contract. When they contract and get tight, it gives you the urge to want to pull again. And the more you pull, the more stretching you are making in the same area of the neck. So the big question is, how do I get rid of this? These are the things you need to do. When the next urge comes, what I'd like you to do is take your head, and I'd like you to bring your chin down to your chest and bring it all the way down. Let your head fall. As you fall, you'll feel stretching behind the neck muscles, and just kind of lean it to the right as you let it fall forward. You'll feel muscles pull on the other side. Then you go the other side. You'll feel the other muscles pull behind the back of the neck and shoulders. I want you to get in the habit of using the weight of your head, the 12-pound weight. And I like you just to let that neck go forward. What we're doing is we're stretching those tight muscles naturally. And as we continue to do that over time, the body will start responding in a positive way. The next thing I want you to do is do some light neck rolls. As we do light neck rolls, we're taking different areas of the neck and those muscles, and we are babying it. We're kind of like pacifying it. We're saying, okay, neck muscles, I know you want to be pulled on, but we're going to do it gently. So what we're going to do is just do some nice clockwise neck rolls. Okay, you can just do maybe about 10 or 12 of them. Then you go counterclockwise. Light neck rolls. You may feel a little clicking and cracking in your neck, but don't worry about that. Just light neck rolls. Very gentle. Pacify those muscles. The next thing I'd like you to do, I'd like you to take your fingers and clasp them around the back of your neck like this. And when you clasp them, I want you to push into that neck and squeeze that neck as you clasp. Go ahead and squeeze it. Now what I want you to do, I want you to take your chin and bring your chin to your chest as you continue to squeeze those muscles. And you'll feel those muscles kind of release, and you'll hold it there about 30 seconds. As you take deep breaths and blow it out, just keep squeezing as you let your chin fall on your chest. Beautiful. And you'll feel those deep muscles start to release. You'll hold that about 30 seconds. That's a great exercise. We're targeting different muscles behind the neck that attach behind the head that's going to release to give you a lot of relief. The last one I'd like you to do are chin tucks and shoulder blade squeezes together. The chin tuck, you're going to keep your chin neutral with the floor. Do not flex your head forward or backwards. And what you're going to do is you're going to tuck your chin in just like this from the side, as if you have a double chin. Okay? You go forward and you come back. Now, at the same time when we do that, we're going to do our shoulder blade squeeze. So we're going to pinch our shoulder blades back together towards the spine as we stick the chest out. So we're going to do it together, and we'll do like 10 or 12 of them. So what we're going to do, we're going to bring the chin back, stick the chest out, squeeze the shoulder blades. Good. Hold it for like 2 seconds, 3 seconds, come back. Good. Chin tuck, Squeeze the shoulder blades. 3 seconds. You'll actually feel the abs stretch open a little bit too. Go back down. Back, shoulder blades. Good. You hold it about 3 seconds. Do about 10 or 12 of those. Now what we're doing is we're doing the chin tuck, bringing it back. That's going to stretch the suboccipital muscles underneath the skull. It's actually going to work the deep neck flexors to have better posture, because generally we find a lot of people who crack their neck have very poor posture, rounded shoulders and forward head posture. And at the same time, when we do that chin tuck, we're going to squeeze those shoulder blades back, lift the chest up. So this is what it's going to look like from the side. Okay? As the chin comes in and tucks, chest comes up, shoulder blades come together. 3 seconds, and you relax. Again, chin back, double chin, shoulder blades together, chest up. Good. So by doing the chin tuck and the shoulder blade squeeze, we're not only helping forward head posture, we're strengthening the deep anterior neck flexors. We're actually contracting the upper traps as well as utilizing the back of the muscles that go behind the skull. We're working actually the scalenus muscles as well as the sternocleidomastoid, the SCM muscles, and we're actually contracting them. We're utilizing different muscles. This is a great little stretch. Now, do all those stretches. You can do one after the other, and that's really going to help you. You can do this several times a day. But now here's the key thing. Within 21 days, your subconscious mind will break that habit. This is a habit you've been doing for a long time, and you can't afford that, because if you start degenerating discs, causing osteoarthritis, pinched nerves, and disc degeneration, as well as herniated discs, this is going to give you a lot of problems in the future. So I hope this video was very helpful. Please leave your comments below, particularly for those worldwide, for those that read these comments. I'm sure you can be a big help for them. I'm sure that they'll like to respond, and you guys can respond together. I ask you to subscribe if you haven't, so you can continue to receive the best of the self-help videos for postural and your spinal well-being. And most important, I ask you to make it a great day. I'm Dr. Alan Mandell.